Why vaccinate? Is it truly that important? Are vaccines really safe? When is the right time to vaccinate my baby or child? In this short session, I will discuss 3 of the questions I hear most often when it comes to childhood immunizations. Hello, my name is Esther Wynne. I'm a registered nurse who has been giving vaccinations to infants and children here in Bighorn County for the past 30 years. First, I want to respond to the question, why vaccinate? If you are watching this message, you are striving to be the best parent you can be. That includes keeping your child safe and protecting them from harm. You want to do everything possible to keep your child healthy and protected from preventable diseases. Vaccination is the best way to do that. Vaccine-preventable diseases include measles, whooping cough, Haemophilus influenza type B, and influenza. Children in the United States continue to be affected by these and other diseases that can be prevented by vaccination. Sometimes these infections result in hospitalizations or even death. You might ask, why not just wait and see if my child gets infected by one of these viruses or bacteria? If they get sick, the doctor can treat my child, right? The fact is that there are a lot of diseases that scientists and doctors do not yet have a cure for. The best way to treat these diseases is to prevent the infection in the first place. When parents decide not to vaccinate their children, it gives these diseases an opportunity to spread from child to child unchecked. We call this an outbreak. Sometimes the disease spreads to infants too young to be vaccinated or to people with weakened immune systems, such as people with cancer. When vulnerable people get infected, the chance of long-term complications or even death increase. So, vaccinating your child actually protects others that you care about too, not just your own child. The second question I often hear is, are vaccines really safe? Vaccination is safe and it is effective. All vaccines undergo long and careful review by scientists, doctors, and the federal government to make sure they are safe. In all honesty, there are risks associated with vaccinations, but those risks are much, much lower than the risk of leaving your child unvaccinated. About 1 or 2 people in every million doses of vaccine have a severe allergic reaction. That's why we ask you to watch your child carefully for a few days after their shots and call your provider if any concerns arise. Allergic reactions can be treated. You will see and hear stories that accuse some or all vaccines of being dangerous or even deadly. These stories are all over social media and the internet. Be aware that there are many sources of false information out there. Be wise. Make your decisions about vaccination after speaking with a trusted healthcare provider. Finally, I often hear the question, when is the right time to vaccinate my child or my baby? The antibodies that a newborn receives from their mother's blood are almost gone by 8 weeks of age. This is why the first set of baby shots are recommended at 2 months of age. The recommended childhood vaccination schedule for the first year of life is 2 months, 4 months, 6 months, and then 12 months. The diseases that these vaccines protect against are the most severe in infants and young children. That's why the timing is so important. In order to give your baby the best protection from vaccine-preventable diseases, start vaccinating your child at or near 2 months of age. In closing, there is so much more information available on these vaccine topics than I have time to discuss here. Be careful where you look if you go on the internet. There are several organizations that masquerade as science-based, but are actually presenting a twisted version of the facts to scare parents away from vaccinations. We are trying to help you realize that parents should have more fear for the diseases that vaccines prevent than fear for the vaccines themselves. Here is a link to science-based materials from several respected organizations. Check it out. You can share this video with anyone who might have some of these questions. Remember to like our Facebook page or subscribe to our YouTube channel for more helpful videos like this. Thanks for watching. And thanks for being such a great parent to your little